Hello, everyone, and welcome to the show. Summer should be a time for beach walks and backyard barbecues, but for those with diabetes or peripheral artery disease, it could be a season of hidden dangers. That innocent stub toe from a flip-flop mishap, yeah, we've all been there. For someone, though, with compromised circulation in their legs, it could lead to a non-healing wound, infection, and in worst cases, amputation. Now, alarmingly, summer foot injuries are often the first sign that someone has peripheral artery disease or that poor circulation in the legs. That's right. Many people discover this life threatening and limb threatening condition only after a minor foot injury refuses to heal. So, today we're going to learn all about this. We're joined by renowned podiatrist Dr. David Alper, who brings over 3 decades of expertise from his distinguished career, including his work as emeritus surgical staff at Harvard's Mount Auburn Hospital and his leadership with the American Diabetes Association. Dr. Alper will guide us through the summer foot follies he's witnessed and also provide some critical advice for protecting your feet when your circulation is compromised. So, welcome, everyone. And Dr. John, my amazing co host.
I'm just kind of trying to figure out how much alliteration you can provide us with, Kim, regarding feet and follies and flip-flops and whatnot. So I don't have any, we don't necessarily have to do inspiration today, but I took my favorite chatbot, Claude, and I asked him or her, but I think it's a him, to find me some alliterative phrases using the word F and related to feet. So can I read a couple of them?
They safe for work. Let's start with the basics.
Yeah, exactly. Here we go, Dr.
All right,
Alper.
all right. So here's
Ready
one.
for it.
Fashionable Fiona flavors, fluffy, fuzzy foot warmers. Okay.
I like
Um,
flavorful feet.
Faithful friends find fabulous footwear for festive functions.
Oh, okay.
And then here we go. This is right up David's alley because I'm sure you've seen this. Fragile, frozen feet frantically fight frostbite.
Yes.
Okay, my work here is done. Mic drop,
And
and
you
I
know
will
what?
acquiesce.
Like the
Getting that
antithesis
into
of
the chart
summer.
is fabulous. So,
Yes.
I'm sure, Dr. Alper, you have quite a few of your own, but I imagine that the frostbite is probably an antithesis of what we're going to experience this summer, unless you head up to Antarctica or
Right.
somewhere.
well,
Well, I mean, I imagine, he's probably seen pretty sick, and this necessarily isn't PAD related, but pretty significant sunburn. I think a lot of people forget to put sunscreen on there on the piggies. And so, yeah, I'm sure he's seen that. I have.
I'll take you back first to what you were speaking about before. Believe it or not, I had a patient about 15 years ago that did present with frostbite in July. Now, how in the world could that happen? Well, because they got a little sunburn on their feet and they actually were still able to feel their feet, and the feet were nice and hot. So they thought the perfect thing would be to put their feet in an ice bath
No.
for an hour and a half. And
Wow.
with circulation issues to begin with, and of
Mm.
course, ice water drives away any hope of circulation getting.
Yes, it does.
And the biggest problem, and John, I'm sure you see this in practice too. Patients do what they think is right. No, very, very few people set out to hurt themselves, but the thought process doesn't go along with the intent, and then they get embarrassed. And so they did this ice thing on a Saturday, but they didn't come to me till Wednesday.
Hmm.
And at
Hmm.
that point, the what are chilblains set in, and the blistering set in, and the beginnings of frostbite set in. And so, yeah, we actually wound up
Well, I
losing.
mean, David, right? Like if you think
It's-
about it, the foot or the toes are the farthest distance from the person's brain, and so maybe they're the least to some degree.
Well, yes, they're probably thinking the list. I think that's probably true.
But
Um, One of the things that's amazing is the wide variety of things that people soak their feet in. And so much of it is from anecdotal information. God bless Dr. Google on the internet. And what's also really kind of scary to me is that patients will take advice from complete anonymous strangers over the advice that they get from sitting in an exam room with a doctor.
Mhm.
And so I've had people soak their feet in kerosene, gasoline, bleach, lye. I mean, I can't even begin to, all things that, by the way, say very clearly on the bottle, keep it off your skin.
Yes.
So, ice water in July was just another of them, these things. And again, nobody's setting out to hurt themselves, but sometimes intent and a little bit of following what makes sense doesn't always go together.
Yeah, we
And
did have it, and sometimes there also is a lack of education sometimes in some areas, especially impoverished areas. We had some patients over in the Philippines that were using bleach to soak
yeah,
their wounds, and that was all they had. They didn't know anything different. Was it doing any good? No, but they still did it, and every single one of them was on deck, for amputation until they found us, and I discovered that there is an Amazon Philippines. And I was able to send a whole bunch of wound care supplies to be distributed to one community. But I hope that it made a difference. I know it did for at least one patient that we couldn't save the toe, but we were able to save the leg.
well, let me take this back to where John brought up a really good point from the get-go, and that is sunburn of the feet. People, smear all sorts of, 50, 75 all over their bodies. But to your point, John, the feet are the farthest part away. And as you get older, it gets harder to reach because they get farther away as you get older. I didn't know you knew that or not.
Yeah.
And so they wind up not putting it on the tops of their feet. But here's the deal. The top of your foot and the top of your hand are the two places in the body that have the least fat. It's basically skin and bones. So when you start getting ultraviolet rays there that start burning the skin, there's nothing to give any extra moisture. There's no fat to give moisture to the skin. And then, of course, you have circulation issues, and your circulation is the only thing that brings water to the skin. So it's very, very susceptible to sunburn and leading to blistering much quicker than like the tops of your thighs or your shoulders or something along those lines. It is crucial if you insist on walking around flip-flops or, God forbid, barefoot, that you get that sunscreen on the top of your feet. And of course, everybody wades into the water. You may not go up to your waist, but it's so nice to wiggle your toes in the water to replace it when you're at the beach so that you continue to keep the sunburn down. Sunburn on the top of your feet can go to second and third degree burns within an hour, which is not true on the rest of your body. And so right off the bat, there's something that, I could drop the mic now and that advice alone is
Kim's going to take it from you.
Coming up on The Heart of Innovation right here on a KDOW. One more Foot Follies with Dr. David Alper. So don't go away.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just cut your leg off?
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for.
Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Welcome back, everybody. Thank you for joining us. We are continuing a fun and fragile, fancy, fearless conversation with Dr. David Alper, who's fiercely fighting for feet care.
This is
I couldn't figure out that.
This is epic. This is epic.
well, foot care is one word, so
But
that's
so, okay, during the break, Kim was going to share a story off air, and I said, no, you have to share this story on air because we were talking about
executive decision.
Using sunscreen and, sandals and the blisters that can occur. So Kim, you wore sandals for the first time this weekend?
I did. I mean, and that's a big issue is when you put on those sandals for the very first time or the flip-flops, there are little edges to them. And so if you're on your feet all day, especially in the hot sun, your feet start swelling. You don't think about it. I went to a baseball game with one of our patients, which you remember, Coach Tommy, and they had won the game. And
Oh, Coach Tommy, that's awesome.
And we love Coach Tommy. 85-year-old amputee who's just killing it with their team #1 in state at the JC baseball. But needless to say, I'm trying to steer the conversation away from my own folly here. But I put the sunscreen on. I knew Dr. Alper would be very happy. Put the sunscreen on my toes, put the sunscreen on in every single crevice of where the sandal was not covering, which was a lot. And I set off. But I was on my feet most of the day cheering for Coach Tommy. And I was in the hot sun, my feet swelling a little bit. Well, guess what? I ended up with an ulcer because the edge of the sandal started digging into the top of my foot. So what do? I go home. Next morning, I wake up, starts bothering me a little bit. I go in the hot tub. I go meet my dad and we go in the hot tub to bond on in the morning on the weekend.
But you forgot about the blister, right?
It hurt, but I forgot about it.
Because again, it's the farthest, appendage from your brain.
Yep.
It's in the
and I went in there, and it's just been getting worse. So what do? Go back in the hot tub again, and then I get in the shower, and it's completely red. I'm looking a little yellow in the middle, so no surprise, right? So what do?
Well, an internet.
I'm a big disappointment. You can start there.
Yeah. So first of all kidding aside, you fortunately do not have PAD and diabetes because that is exactly the type of thing that could lead to an ulceration, which could lead to an amputation as well as a fairly nasty infection. So while we are speaking light of this is really the beginnings of a little horror show here. I'm assuming that you're still young and healthy. And I'm assuming it's not all the way down to the bone. So I would treat it topically for a couple of days. I would keep it covered with a topical antibiotic. I would clean it with some peroxide, no iodine, please. But I would keep a piece of gauze, no Band-Aids. We don't like Band-Aids.
Oh,
We
interesting.
actually never like Band-Aids. Well, number one, the adhesive is too aggressive. And if you're going to wear a bandage for 5-6 days, you're just going to irritate the skin that the Band-Aid's stuck to. The other thing is Band-Aids don't breathe. They're really good at keeping stuff out, but they're also really good at keeping stuff in. So a nice piece of gauze with a couple pieces of medical tape is a whole lot better. And you're going to monitor it a little bit for a while and see how it does. You might need an oral antibiotic. I don't have it in front of me.
So David, let me ask you, because I think this is a very worthwhile segue to spend some time with, because
Sure.
I think a lot of patients, to our earlier points, don't know when something's wrong or when it's just part of the healing process. So just what are like 3 or 4 things objectively that someone, when they see them on an ulcer, whether it's the toe or the heel, that in your mind the alarms are going off and you need to raise the flag and seek medical attention?
Well, that's an excellent question, John, because the reality is patients need to be advocates for themselves. And at the end of the day, they have their foot with them. I don't. So they're going to, their alarms are going to be the big ones. First and foremost is odor. If a wound has an odor to it, it's infected deeply, because one of the things that happens, bacteria eats the skin, bacteria eats what's there, and it gives off gas. And the gas has an odor to it. So if you have an odor, and it's a fairly nasty odor, that's a reason to get to the doctor ASAP. That's not
how quickly can an odor occur?
within 24 hours.
Okay, so you need to be diligent and really fiercely looking at. Okay,
and the odor could be on your sock. If you're wearing a sock and you don't have the wound covered, and the fluid leaks out of the wound into the sock can give you the odor. I will tell you, very often people come to me with wounds they didn't know they have on the bottom of their feet because they see a blood spot on their sock or they see an odor on their sock. and they don't feel it because of loss of sensation, what we call neuropathy. So odor is the first thing. Redness is the second thing. Now, obviously, a wound is going to be a little bit red, but if that redness is creeping away from the open area, if the redness is spreading, that's what we call the beginnings of cellulitis, which means the infection is taking hold of the healthy skin as well as the unhealthy skin. So as redness, now that doesn't happen within the first few hours, but if you wake up on Monday and you see this wound, then you wake up on Tuesday and the redness is the size of a quarter instead of a dime, that's the second thing. The third thing is that you want to see what's leaking out of the wound. Now, we all know that blisters has clear, sometimes clear bloody liquid. Clear is okay because clear is the way that the body protects itself. It's kind of an internal washing and a padding. But if you're seeing cloudy fluid coming out, white, creamy, pink white, that's infection, because infection is actually eating the protein that's in that clear fluid that's trying to help healing.
What about a blister? Should you pop a blister?
Absolutely not. The blister
good
is the
question.
body's way of protecting. It creates an immediate cushion for itself. And again, that clear fluid is full of protein and a little bit of white blood cells, which help fight infection and heal. So the worst thing you can do is take that pin and hold a match to it, because that really sterilizes it well, and then poke it and then give it a good squeeze, like what is the Dr. Pimple Popper or whatever they call themselves? No, and by the way, blisters will basically pop by themselves. Do not rip that loose skin off. That skin is there for protection. And by the way, when you grab it, it's like a pull tab. You're just going to keep going all the way up to your knee, pulling that little piece of skin, okay? So whatever's there, just leave it there. That's the reason your body put it there to begin with.
I don't know how I ever made it to age 49 because everything you said was the antithesis of what we did. I always remember my mom saying, "Oh, let's pop that," and we would take the match and we would,
We go. Oh, yeah.
sterilize. Wow.
It-
Amazing. I
I'm
had no
here
idea.
just to kill people's fun and make moms look bad. But then again, moms used to give you castor oil to keep you healthy, and there you go.
Well, speaking of killing fun, we've got to go to break, but stay with us. We'll be right back.
Your type of condition is called critical limb ischemia. It's the most advanced form of PAD or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to PAD and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with PAD.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane.
The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options. We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back, everybody. Thanks for joining us. So Well, we covered the top, three things to look for. We've covered the blister. Don't pop it, let it be. So now we're kind of, I think, morphing into people are walking around with bare feet, which in your mind is probably not a good idea
Well,
ever.
it fed my family and gave me a lot of business, John. So
That's
in that
true.
respect, it was wonderful. It's a dangerous world out there. Whether you have neuropathy, a loss of sensation, whether you have circulation, whether you have diabetes, or just walking around. I mean, I cannot tell you the things I have pulled out of the bottoms of people's feet.
Oh, do tell.
Well, everything from staples to thumbtacks to small toys to razor blades to paper clips, anything that's sharp. Because think about it. Number one, your average human being weighs 150 pounds, and most of us don't know the average human beings. Here's a fun fact you can take to parties. Every time a human being puts their foot down, 2 to 3 times your body weight goes through your foot. So a 150-pound person is putting their foot down with 300 to 500 pounds of pressure. Guess what? You step on a thumbtack, that thumbtack is going through your skin.
Well, and that's of the assumption that the person has normal architecture of or that,
Absolutely.
So then, right, as we get older, things change. I think I remember you telling me the foot shrinks.
No. Feet get bigger as you get older.
They elongate. Okay, so then.
Right, because the ligaments that hold the bones together stretch.
Right, so
they
they elongate.
grow. You stop growing it a long time before, but things just splay out and flatten, which is why people's shoes wind up being tight because they wear the same size 9 and 30 that they do at 60. But that's getting off on a tangent here. We'll have that.
Oh, I could bring us back. You brought some PTSD back for me because I was one of those and with bare feet, and you won't believe what I stepped on. I'm going to hold out to tell you what I stepped on because I'll bring you back to the experience. I was in law school. I was so excited that I had, nailed my first case. And it was
But
like,
you went to law school?
Barefoot?
So I ended up getting this first case that I was so excited about. And I could go out that night, which I didn't think I could. So I was excited to get out, grab my phone, call my friend, ran out into the living room and stepped on something. No clue what. All I knew was that I was in excruciating pain and I couldn't put my foot down. And there was a clean hole the size of a pin and there was no blood. It was completely clean. Couldn't figure it out. My parents were getting ready to go out that night. I said, oh my God, I can't put my foot down. I don't know if I stepped on something. They look, I had Dr. Mom, Dr. Brother sitting there looking at they're not doctors, looking at my foot saying, you're fine, suck it up, go out tonight. It's just a sting.
You've earned
and
it.
then it kept getting worse and the pain was excruciating. So my brother drives me to the emergency room, drops me off. They all think I'm a complete joke. I go into the clinic. They're looking, they're like, there shouldn't be anything in there because it probably just came out. It's probably fine. I'm like, then why would it hurt this bad? So they start poking around. They see nothing. They're about ready to go in to send me to x-ray because I was relentless. I'm like, I'm not leaving here. Something's in there. They found a 3/4 inch green toothpick all the way in there. Longest tweezers I'd ever seen. And they pulled it right out. They couldn't believe it. They were so shocked. They started bringing in all of their colleagues to take a look because the one weird part of it was we couldn't figure out why there was a little green around the edge. Well, we discovered that after.
And I was going to guess a toothpick. I must have taken 24 toothpicks out of people's feet.
Are you serious? Is it always that clean? Wow.
Well, they're sharp and yet they break. And the skin naturally closes around it because that's what skin does. It's to protect itself. You're not going to have a hole with an arrow that say, look here. I mean, these are the ways that the body protects itself. It's a dangerous world out there.
Yeah.
Barefoot. No. Here's another reason. Let's go back to the summertime. Okay. The sand is hot. The blacktop in the parking lot is really hot. If you have pets, I bet you watch out for the fact that tar gets up to 150 degrees in the sun all day long. So dogs do that little dance because you're making them walk through the parking lot and you're burning their soles. Well, your soles can burn too, and you can easily get a 2nd or 3rd degree burn. One of the things you should do, especially if you have PAD, especially if you have diabetes, before you get out of the car, you or somebody needs to touch the road or the sidewalk or the blacktop with the back of your hand, not the palm. That's too thick. With the back of your hand to see how hot it is. And if you pull your hand away, you don't want to be walking on it because you will burn the bottoms of your feet. The sand is the same thing. That white sand is sitting in the sun from 7 a.m. until 6 p.m. It's heating up. And this is a place where you can really get a burn. We've all seen people dance their way across the sand, and that's when they feel it. So these are the types of things that really can happen in the summer. I generally don't like flip-flops for a whole variety of reasons, but flip-flops are 1,000 times better than nothing.
Coming up right here on the Heart of Innovation, we're going to hear why he does not like flip-flops. That's next right here on the Heart of Innovation on KDOW. Don't go away.
When your sugar runs high, it's more than a sign. Diabetes creeping in, it's a dangerous line. Pre-diabetes too, don't think it's too light. It can lead to PAT, so start the fight. Sugar's sweet, but the cost is real. High blood sugar makes your arteries feel clogged. Slow flow, it's a ticking time bomb. Catch it early, stay strong, and keep your legs on. Sugar's not so sweet when your leg is in pain. Not controlling sugar is where peripheral artery disease sets in. Got sugar? Get checked. Don't wait too late. Save your legs, save your life, take control of your fate. Leg pain, cold feet, neuropathy too. These are signs diabetes caught you. High sugar's the link where circulation and pain left untreated. Your leg might end in flame.
Welcome back, everybody. Thanks for joining us. So, no bare feet, flip-flops you don't like, but they're okay. You know, people that are listening are probably thinking, is there any, can I go outside in the summer? Like, can I leave my house? So David.
Yeah, I'm a buzzkill, John.
Well, no, we're just out there to help folks. But again, help us make that connection. Brain, foot, farthest part away. How do you bridge that gap for us?
Well, first and foremost, either you or somebody that loves you very, very much needs to look at your feet. And all kidding aside, it's not easy for people, especially as you get older, to see the bottoms of your feet or between your toes. So when you get back from the beach, it's a really good idea to just take a look at your feet. You know, did in fact you step on something, you cut something? You know, sea urchins. I've pulled out dozens and dozens of sea urchin needles from people stepping on them on the beach. You know, little crab claws, you know, shells, broken shells. So it's really good to do that. You know, a foot massage is always a great idea, you know, again, preferably with someone who loves you dearly. You know, creaming your feet, especially after the beach. What a wonderful way to treat yourself with something nice. You know, pick a cream. I don't advertise any cream. Just the very act of putting some moisture on your feet, because of course your skin's going to dry out from being in the sun all day. So, you know, the massaging of it helps the circulation a little bit. If you want a recommendation for cream, make sure the cream has lanolin in it. That's the best moisturizing factor in a cream, and many, many of them do. But that's a great way. Just rub the tops and the bottoms. Never put cream between your toes. Don't want to put it there, because that's how you clog sweat pores. We got a whole bunch of sweat pores between your toes. But that type of thing is great.
What about people that put the cream on and then socks and they sleep in it?
That's fine. Great way to hydrate your skin. Great way to hydrate your skin. I mean, you know, and obviously a thin layer. Don't put half a bottle in there, for God's sake. But that actually is a great way to kind of seal it a little bit so that the cream gets absorbed. Because as your feet get a little warmer, your sweat pores open up and absorb all that cream. So it actually is a very good thing to do. However, here's my buzzkill again. Make sure those socks fit properly. If you take your socks off at the end of the day and you got a nice ring around your calf or around your ankle, because that thing is wicked tight, you're cutting off circulation. So you want to make sure that those socks fit properly, that they stay up with broad circulation. But otherwise, sleeping with socks and cream is something I've actually recommended to many people.
But not socks and sandals. You should never leave the house with socks and sandals.
Well, I mean, there are social implications.
Come on, Kim. That's a faux pas, right?
You know, maybe in Cambridge here in Massachusetts.
You know what?
But otherwise,
we were in the middle of nowhere in Pennsylvania, and an ambulance came for one of my parents, and it was a volunteer fire department. They showed up with flip-flops and socks. I literally could not believe it. I'm like, I can't even deal with that on a daily basis out on the streets, but then to have the volunteer fire department show up with socks and flip-flops.
Well, they were probably, maybe they were at a picnic or something.
That could have been. That could have been.
I don't know, Kim, you're playing fashion police here. That's, I don't. So here's the best thing to wear on the beach.
Yeah, I was going to say, because you're telling people, I mean, no flip-flops.
No. Water shoes. Water shoes are wonderful because they're basically a neoprene sock. So they're thick enough to keep things from penetrating. They're stupid comfortable. They're waterproof. They're great. I personally wear them all. If you swim in a lake, your toes don't get into the muck on the bottom of the lake. Lord knows what that stuff is. You're not going to get turtles to bite your toes and things like that. Water shoes are, and by the way, they look very stylish. It looks like you're a scuba diver or something.
Yeah.
Water shoes are absolutely the best thing you can wear on the beach. They'll even protect it from the parking lot. The only bad thing about water shoes is you don't get any support. You know what? You're running around the beach. Don't worry about support so much.
Well, how about for people that walk around during the summer, because it is hot and you don't want closed-toe shoes. So any suggestion for open-toe shoes?
Absolutely. First and foremost, sandals are okay as long as they have a back strap and you use the back strap. Why? Because when you wear sandals that don't have a back strap, the only way they stay on is by gripping. You're grabbing that front of the shoe. So you're walking around like this. Well, that's not the way we're designed to walk. First of all, you're going to wind up getting a case of hammer toes, which is when the toe is cocked up. And people don't like that. Second of all, the tips of your toes are rubbing on the bottom of the shoe. And that skin is really nice and soft. It's going to go back to your little blistering, Kim, that you talked about. But if you use the back strap, the sandal stays on by itself. And so when you pick up your foot, the shoe comes with you. It's the same thing with Crocs. I actually don't have a problem with Crocs. Crocs have a nice little arch support.
I love Crocs.
They're great. But I bet, John, you take that strap that you think is decorative and you move it forward so you can scuff in and go. No.
All right.
The reason that strap is there. So if you use the straps to keep them on, sandals are fine, Crocs are fine. And you're right, Kim, you don't want your feet to overheat either. So letting them breathe in the summertime is actually a great thing to do, as long as they're protected.
What about, is there anything you can do to prevent some of the orthopedic deformation that occurs as we get older? I mean, because a lot of times I'll see patients and I don't know what the technical term is, but the toes will cross over each other and then they get a little ulcer between the two. So you have a spacer. Is there anything you can do? I mean, like, let's say, hopefully we've got younger people listening. What type of shoe should they be wearing now to prevent some of these things? Or are they not, can you not prevent them?
Well, of course, some women like to wear shoes that you can play soccer with a BB with. I mean, these things that are shaped like this, when your foot is shaped like this, doesn't really work very well. Now, you're going to a wedding, it's 2-3 hours, you're going to kick them off half the time. I mean, of course you can get away with it for a short period of time. But the reality is that feet get bigger as you get older. We've talked about that. And so you need to continually check the size of your feet and make sure that they fit properly. And just because they fit in 2015 doesn't mean they fit in 2025. An incredibly simple way to check is, and it sounds a little silly, but take a piece of paper, step on it, and trace your foot when you're standing. Because of course your feet splay out when you're going with full weight on your foot. Cut out your little foot and then hold it up to the bottom of the shoe that you're thinking of buying. Well, if the paper is bigger than the bottom of the shoe, guess what? The shoe's too small. You could also hold the bottom of the shoe just up to your foot if you want to, and do the same type of thing. But when shoes don't fit properly, John, when they're pushing on the sides and in the front for 8, 9, 10 hours a day, with that 300 to 500 pounds I'm talking about, that's where those deformities come from.
And that's being generous.
And that's being generous.
Coming up right here on the Heart of Innovation, we'll have more with Dr. David Alper, so don't go away. Stay with us right here on KDOW.
Collateral flow is your body's way of saying, help me. And so what it does, your body sends little chemical messenger system into the tissues, which is called neovascularization, which is a fancy word term of saying the body kind of knows how to heal itself, and it forms its own vascular system. And so when you walk, you actually promote ischemia, which ischemia in turn, ischemia is lack of blood flow, which causes the pain. The pain and the lack of blood flow causes chemical messengers to be released where your body starts developing these extravascular systemal beds. And so I tell my patients there is nothing better than I can do or recommend, not even a stent, because stents don't technically save your lives. It's the walking that you do after which saves your life. And it's the same thing with the coronaries. It's the same thing with the peripheral. It's the walking that really saves your life. I can go in there and look like a hero, but what you have to do at home is the most important part, which is, of course, the walking, the diet, the diabetes control, the smoking cessation, everything else. And typically, I just hand back. It's like, look, I'm giving you back this hot potato. It's on you now. I've done as much as I can, but I'll be on your side. I'll be your advocate, but there's only so much I can do. But I do promote if you can walk 5 minutes every day. Just remember this one thing I tell them. Remember, if you walk 5 minutes in one direction, you're going to be walking 5 minutes back home unless you're taking a tent with you, because then you're going to sleep on the street. Otherwise, you're going to be doing 10 minutes every day and be like 5 minutes there and 5 minutes back. Be like, yeah, that's true. And then just build on that. Your body will tell you more. And over time, you'll be doing 30 minutes and you won't even realize it. And so, and the other one I tell them all the time is like, look, if your legs hurt, that's great. Walk 30 seconds to a minute past the pain, sit down, let the pain go away. That's your body's way of healing itself. Remember, no pain, no gain.
Welcome back, everybody. 4 minutes left with our colleague and friend and podiatrist extraordinaire, Dr. Alper. So, David, any parting thoughts? What are two take-homes that our listeners should walk away with?
Number one, look at your feet. It's the only way you're going to guarantee you're going to catch anything. It's a nanosecond. Look at your feet, number one. Number two, protect your feet. Sunscreen, something to walk on the sand and on the roads when you're going from the car to the beach. I'd say those two things will keep your summer happy, healthy, fun. Avoid toe trauma. There's some alliteration for you. And really, truly do enjoy yourself. You can enjoy yourself and have fun and not cause problems by just protecting those feet.
Oh, it's the best time to get out there and walk as medicine to improve your circulation naturally, of course. And there was a tip, and I can't remember if it was you or for some reason I keep thinking of vascular surgeon Dr. Jacqueline Majors, who was our vascular surgeon of the year through the Global PAD Association. One of you said that especially for diabetics, to put a mirror on the floor in front of the toilet. It sounds really funny, but then every single time you go in to use the toilet, and it should be every day, right? You sit down and you put your feet up to check your feet. Check the bottom of your feet.
That was definitely not me. I'm not a toilet doctor, but I have told people.
Who is? Wait, do you know toilet doctor?
Using a mirror to see the bottom of your feet doesn't work. I mean, obviously, be careful. Don't step on the mirror because that would be sad. But yes, if you live alone or if you live with somebody doesn't have a foot fetish or is shy, then yes, a mirror is a very good way to check the bottom of your feet. But here's kind of like part 2B. Just because you don't feel it doesn't mean it's not happening. People develop loss of sensation, loss of the ability to feel without necessarily knowing it. And so you could have a cut on the bottom of your foot. You could have something in your foot without knowing it. And that's why I started off by saying, look at your feet. And if you do see something wrong, find a colleague of mine. Do not break out the pin and start digging for God and glory. I guarantee you're going to make things worse.
What about clipping your toenails?
Straight across. They're not like fingernails. Fingernails, you follow the curve of your finger. That is not the case with toenails. You don't want to go digging into the corners and then rip out the nail and a little piece of skin, and that's a keeper because that's a good one. You want to cut them straight across, and then you can file them a little bit in order to do that. But make sure that, number one, you really can reach your feet properly, because once again, feet get farther away as you get older. And if you can't really reach them, you're going to cut yourself. I almost guarantee it. And to make sure that you use something that's frankly sharp enough to cut the nails. So that
And 30 seconds, if you have PAD or
No,
diabetes,
then leave them
Medicare,
alone. Leave
Medicare,
them. You take them. Medicare and most
pedicure.
Oh, pedicure? I'm sorry, I just said Medicare. Well, let me finish the thought. Medicare and most insurances will cover a professional to cut your toenails so that it prevents problems. So you can have this covered by a physician. Pedicures for people with PAD and diabetes? No, 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 no. Pedicurists are wonderful human beings, and they do a much prettier job than I do, but they are not trained to deal with the problems. And here's the reality. If, God forbid, they cut you, and they don't do it intentionally, but life happens, they have no tools whatsoever in their arsenal to deal with the cut that you have. And a cut to a PAD or diabetes patient can be a disaster.
And on that note, thank you so much, Dr. David Alper.
His last word is disaster.
That's right.
Right there. Good ending. No, you've inspired us all, and we appreciate it. It's really important information. Thank you so much, everyone, for joining us, and have a great week.
You have leg cramps that stop you in your tracks, aching and tightening that always comes back. It could be your arteries signaling something's wrong. Let's dive into this journey, come along. Walking down the street, feel the birds let in. Simple strolls turning into fights within. Don't ignore the signs.